What if the items we toss away had the power to change a life? What if something headed to the landfill could transform an entire community? There are literally tons of medical supplies in the US that go to waste that still have the capacity to change a life. Every year, SOS collects thousands upon thousands of medical items that otherwise would have been thrown away, and we responsibly redistribute them to improve health in communities around the world. In developing countries, medical resources are so scarce that nearly 6 million children die every year. Even a broken bone or impaired sight can be devastating to these communities. By helping supply clinics and hospitals, we can deliver critically needed medical care. We receive reports from our overseas partners every week about a child or mother or a father whose life was saved thanks to SOS medical supplies. SOS's CEO, Denise Sears, got to experience the power of donated medical supplies firsthand.
I had the unbelievable experience of witnessing the supplies donated by our hospital partners and shipped by supplies overseas in surgeries that were restoring sight to people. There was one young boy who was blind, and I witnessed the day of the surgery. He had to be led by his father. He could not independently move around. And after the surgery, he not only regained his sight sufficiently to be able to be independent, but he's going to be able to return to school. Seeing the look that goes across the patient's face, it was life-changing.
SOS takes a holistic global health approach and coordinates resources from our network of partners to address clean water and malnutrition in addition to medical needs. We are creating sustainable change that truly changes lives. And in our local community, we are creating life-changing impact, preserving our environment and enhancing local health by diverting tons of medical items from local landfills. Our local impact has grown, and we provide supplies to animal welfare organizations, free health clinics, and homeless shelters across our city. We are also partnering with schools to equip and train tomorrow's healthcare professionals.
I love SOS. Volunteering here made me excited to become a nurse. SOS gave me a unique opportunity by looking at nursing and the objects in a different perspective, seeing all the supplies and seeing what we were doing, and that we're helping others and sending them to countries who probably don't have what we have, and that really touched my heart.
SOS is responding to the calls for help, whether it's assisting local schools in need of teaching resources or helping build a new hospital in a global region with no medical services. We cannot do this without the support of our community. We need our donors. We need you. Together, we will answer the call for help, make our landscape greener for generations to come, support important local needs, and save the lives of children and families around the world.
Thank you, SOS.
Continue to say that. Thank you.
Thank you so much, man.
Thank you, SOS.
Thank you, SOS.
Thank you, SOS.
Zikomo kwambiri, SOS.